Please pay particular attention to the indication and important safety information at the end of this video. Also, please visit the official patient site for full safety and prescribing information. If your doctor or healthcare professional has prescribed ALKINDI Sprinkle, this short video will help you understand exactly how to administer the treatment. The first step is to check the expiration date on the bottle. Do not use if the expiration date on the bottle has passed. Step 2. After confirming expiration, remove the prescribed dose of ALKINDI Sprinkle capsules from the bottle for administration. There are 3 different options for administering ALKINDI Sprinkle to a child. Firstly, babies that are limited to liquid as main source of food. Secondly, younger children who can be spoon-fed. And thirdly, older children who can self-administer. If the child is too young to be spoon-fed, you should administer ALKINDI Sprinkle this way after checking expiration and removing the prescribed dose from the bottle. Step 3. Take the capsule and hold it so that the printed text is at the top, ensuring all the granules are in the lower half of the capsule. Step 4. Gently squeeze the bottom of the capsule. Step 5. Carefully twist off the top of the capsule. At this point, the baby should be cradled in the crook of the arm so the head is supported but the airway is open. Step 6. There are 2 options on how to administer to a baby. For the first option, pour all the granules onto a small, dry spoon. Gently create an opening on the side of the baby's mouth with your finger. Pour the granules from the spoon onto the side of the baby's mouth. For the second option, gently create an opening on the side of the baby's mouth with your finger and quickly pour all the granules onto the side of the mouth, avoiding the tip of the tongue. Whichever method you use, remember it is always important to tap the capsule to ensure all the granules are removed. Avoid wetting the capsule on the tongue, as this may result in granules remaining in the capsule. Step 7. Finally, once the baby has taken the treatment, you should give them a sip of fluids, either from breast or bottle. This will help to ensure all the granules have been swallowed. So there we have it. You'll now be able to confidently administer ALKINDI Sprinkle to a baby. When administering ALKINDI Sprinkle, there are a few things that you should always remember. The granules must never be added to liquid for administration, as this can result in less than the full dose being given. It might also leave a bitter taste in the mouth. Always discard the empty capsule out of reach of a young child. If you have questions or you're unsure about how best to administer ALKINDI Sprinkle to your child, whatever their age, you must always consult your doctor or healthcare professional.
ALKINDI Sprinkle is a prescription medicine used in children from birth to less than 17 years old as replacement therapy when the adrenal gland is not making enough cortisol. Important safety information. Always give ALKINDI Sprinkle exactly as your doctor has directed. Do not take ALKINDI Sprinkle if you are allergic to hydrocortisone or any of its other ingredients. Adrenal Crisis. Giving too low a dose or stopping medication can cause low levels of cortisol, which can result in serious illness or death. Treatment with intravenous hydrocortisone should be started immediately. When switching from another type of hydrocortisone to ALKINDI Sprinkle, watch your child closely for any changes. If your child doesn't get the entire dose of ALKINDI Sprinkle because of vomiting or spitting some granules out, contact your doctor to see if another dose is needed. Immunosuppression and increased risk of infection with use of a dosage greater than replacement. Use of a greater than replacement dosage can suppress the immune system and increase the risks of new infections or exacerbation of latent infections with any pathogen, including viral, bacterial, fungal, protozoan, or helminthic infections. Monitor patients for signs and symptoms of infections. Growth retardation. The long-term use of corticosteroids in high doses may cause growth retardation in children. Decrease in bone density. Corticosteroids can affect your child's bone growth and strength. Cushing's syndrome due to high doses of corticosteroids. Treatment with high doses of corticosteroids can cause Cushing's syndrome. Treatment should be limited to the smallest dose required and your child's growth and development monitored appropriately. Changes in vision. Tell your doctor if your child has blurred vision or other vision problems during treatment with ALKINDI Sprinkle. Psychiatric changes. Corticosteroids can change your child's behavior or mood. Tell your doctor if your child has periods of extreme happiness, extreme sadness, hallucinations, or depression. Gastrointestinal reactions. Tell the doctor if your child has stomach pain, upset stomach, black tarry stools, or vomiting of blood. These could be signs of ulcers or tears in the stomach or intestines. Taking anti-inflammatory nonsteroidal drugs like ibuprofen, naproxen, or aspirin can increase the risk of ulcers or tears. The most common side effects of ALKINDI Sprinkle include retaining fluids, changes in glucose tolerance, high blood pressure, behavioral and mood changes, greater appetite, and weight gain. Vaccination. Administration of live vaccines may be acceptable in ALKINDI Sprinkle-treated pediatric patients with adrenocortical insufficiency who receive replacement corticosteroids. Please visit alkindisprinkle.com/patient for more information. You are encouraged to report negative side effects of prescription drugs by contacting Eton Pharmaceuticals Incorporated at 1-855-224-0233 or the U.S. Food and Drug Administration, FDA, at www.fda.gov/safety/medwatch or call 1-800-FDA-1088. Please see full prescribing information for more information.